Tell you when. All right, we are live. Welcome, everybody. My name is Tim McMahon. I'm the Director of Marketing here at St. Joseph Hospital. I'd like to welcome you to tonight's broadcast in partnership with the Northern Cyclones Hockey Program. Now, tonight, we have some very special guests who are going to be talking to you about common sports injuries, especially in youth sports, and how to treat them, how to manage them, how to prevent them. And so I'd like to introduce each of those to you now. First off, we have our two providers who work at our family medicine practice right in Hudson, New Hampshire. And down on the bottom left here, we have Dr. Andrew Sebastian, who actually played hockey as well in his youth. And we have Dr. Nowren, who will also be answering our questions as well. So these two will be answering your questions. Now, the person asking the questions up on the right-hand corner of your screen is Kendall Reyes. Kendall Reyes is a St. Joseph Hospital community ambassador. And what's interesting, or one of the main things that's interesting about Kendall, is that he's a former NFL defensive end for the Chargers. Now, Kendall recently retired from the NFL, but he comes out to the hospital and works with us on a number of different initiatives. And he'll be asking the questions and also providing some commentary from his perspective as a professional athlete and what he needed to do to kind of get to that next level. So with that in mind, we have kind of a bunch of pre-prepared questions that we typically get from families about injuries, and certainly these providers can speak more to that. But in addition to that, if you have any questions while you're watching this broadcast, please feel free to put them in the chat box below, and we will answer them in real time. So to get things started, Kendall, why don't you jump on in?
Awesome. All right. Thank you for having me, guys. All right. So we'll just dive right into it. So first question we have is, what are some of the most common sports injuries you guys see over at your practice in Hudson?
Good evening, everyone. Andrew, I will take that question. As a family practitioners, we see commonly, any ankle sprain, injury to the, any joint, question of shoulder dislocation, concussion, so muscle strain. So these are the common things that we see in our office, and then we evaluate those to see who needs what kind of care. Some we do manage in the office with home care, instruction, physical therapy. Some needs more specialized care, so we referred them to our St. Joseph Orthopedics group. And I think these are common things that we see in our office. Am I correct, Andrew?
Yeah, the only thing that I would add there is probably back pain or back injuries. That's fairly common as well. I know we're talking about the hockey team that we're affiliated with, and they're younger people. Thank God they're not as old as I am, because those back injuries are a little bit more serious. But yeah, I would say back injuries, and I'm glad you brought up the fact that we can evaluate them here. We have x-ray here, and we have physical therapy here, which are physical therapy is probably the most common modality that we use for treating sports injuries.
Thank you. Since, we mentioned hockey, what are, specifically for hockey, what are some of the most common injuries for hockey players that you guys see?
So all I can remember when I played hockey, and I think television was still black and white then, not color. But so a lot of ankle. So, if you play defense, you're going to block a lot of shots with your ankles. Shoulder injuries, those were common. And I believe probably concussions is going to fall into that area as well. Certainly there are obscure other injuries as well, but probably foot and ankle, shoulder and head injuries.
Absolutely. Yeah. Concussion is definitely a hot topic, and we'll press more on that a little bit later. How do you typically treat, the ankle, shoulder injuries when, say, a hockey player or athlete comes in to see you guys?
So as I mentioned it already, that we evaluate them in the office. Make sure that there is no fracture, just the strain or sprain. So we have an X-ray in our building, so we can have a stat X-ray. Then patient can, usually wait for the report. We get the report, and if there is no fracture, and it can be managed at home, so we give all the instruction how to manage at home with the sprain, ice, elevation, and and compression, and inflammatories like ibuprofen. And and we evaluate them back in the office to see how they are doing. And at that point, if we think that physical therapy is a good option for that kind of injury, we refer them to our physical therapy. If it's more than that, we think that patient should be seen by an ortho or physiatrist, and we refer them to our St. Joseph Ortho and the physiatry department. And if there is any fracture that we identify during the initial evaluation by an X-ray, we try to call our ortho department right away with our wonderful clinical staff to make them appointments so they can have an appointment before leaving the practice.
Got it. So, yeah, go ahead. Yeah.
I was going to say, I think, the ice is an important thing. The rest is an important thing. Compression. I think ice should be done for the first 3 to 5 days. I think most people would agree it should be 10 minutes on and 10 minutes off. And, if you're going to be putting ice to any part of the human body, I would put some kind of a towel between the ice pack and the skin so that the ice isn't directly against the skin. And 10 minutes on, 10 minutes off for the first 3 to 5 days.
Got it. So to follow up with the ice, so a lot of times, an athlete, they have an injury, they apply ice to it. In what situations would they actually apply heat, to an injury?
I think you would. In general, I would say that you wouldn't apply heat till after the 3 to 5 days has passed. I think in general, for most injuries, it's going to be ice for the first 3 to 5 days.
Got it.
Can I add something? So why we do not recommend to do the heat in the beginning? Because it can increase the inflammation. Our goal is to reduce the inflammation, to reduce the pain and, the bruise. So that's why ice is so important. So, I have, read somewhere that any injuries less than 6 weeks, you can do ice.
Yeah.
Anything over 6 weeks, should use the heat.
Gotcha.
But, as Andrew said, 72 hours or 3 to 5 days is vital for doing the ice.
Yeah, absolutely. That kind of just reminded me back when I was playing, we would get in the cold tubs after every single practice, after every game, just to get that initial, inflammation down. You try to control it as best as you can. And really we would start heating, say we had a tight back, we would do that before going into a game or before practice if we were really stiff. But anything after practice or after injury, we were always ice, cool it down, get the swelling out, get the inflammation out. So it's really refreshing to hear you guys, be on the same page with that.
Kendall,
yeah,
I was going to ask you, so what was, when you were playing and that sort of thing, where did they place ibuprofen? Was it only for pain? Because I think some sports medicine experts nowadays suggest that maybe some of the inflammation in the area is helpful in healing the area, and to just take the ibuprofen for pain management if it's bad enough. How was that addressed in the NFL?
It was case by case, but a lot of times for guys, I just know from my own experience, we would have a lot of swelling, and I don't know if you guys are probably familiar with the drug Celebrex. Yeah. So I'm not sure what class that's under. I just knew whenever I was swollen, we would take Celebrex, put like a ACE wrap or something on to kind of control the swelling, and we'll get in the cold tub. So. Would you be able to tell me what classification of drug that's under?
So Celebrex is same, it's a prescription anti-inflammatory. So people can buy the Advil and Aleve from over the counter, and this is a prescription. Gotcha.
But yeah, when it came to, I would say more the ibuprofen, that was like, say we had like a throbbing ankle injury and the pain was just too much. We'd more so do the ibuprofen just to kind of alleviate some of the actual pain. I'm not necessarily sure on what, in terms of inflammation, like I said, you guys would know better than me. But I know generally it was more so for the swelling, we'd go like a Celebrex, but for like a pain, that's when we would use like a ibuprofen. Absolutely. Great question.
Sorry, the lights went out here for a second, but we're in this energy conscious building, and if I'm not moving enough, the lights just go out.
Right, you might have to jump around every couple minutes.
Yes,
right?
I will.
All right, so I mentioned that we'll kind of get back to it later on. So I mean, hot topic, every year is always concussions. So hockey, of course, being a contact sport. What are some of the things that you guys do when you think someone's coming in with a concussion, or also what are some things you can tell parents, some certain things they can look out for?
Should I take it, Andrew? I can take it.
Yeah, you can start. Go ahead.
So, the three common sports that we know are high for concussion prone are boys football, girls soccer, and boys ice hockey. So I think yearly we see close to 4 million concussion without severe or mild form. So when parents call or we get a call for a question of concern of concussion, definitely our clinical staff is well trained enough to identify how severe it is. If it's need and more imaging and more extensive evaluation, we definitely send those kids to the hospital, to emergency room. But if this is a mild concussion and kids are evaluated by their trainer or coach, in their team, and then they want it to be seen, we evaluate them in the office. I usually follow a screening tool, ACE screening tool that I use on initial evaluation, document that and see whether is there any red flag or not. If there is no red flag, it's just minor symptoms like headache or fatigue, a little bit nauseous, we can treat them and watch them at home with a conservative treatment like rest. The main thing with the concussion, without the loss of consciousness or with if we manage them, we have to pay attention to the recovery, because we want them to recover, completely before going back to the contact sports. Important thing is if you go back early, then the re-injury, re-concussion will put you in a very serious, serious change after. So what you can do for those kids at home that I evaluated can be managed at home, I ask the parents, rest, sleep, hydration, less stimulation, even the TV or the phone or all these video games. Try to limit that. And if let's say a kid came with a headache only, so I recommend them and following a guideline that he can go back to the game again when he is free from headache without any medication for 7 days. And also I usually follow them when they are free for any kind of symptoms. I have them come back and I evaluate another ACE screening tool to see where they are scored. So if they are very stable, free from any kind of symptoms for 7 days, then I clear them to sports again.
Gotcha.
And if the symptoms doesn't get better and getting worse, I then definitely probably will order a imaging or consult with a neurology. So this is usually what we follow in a primary care setting for the concussion.
Got it. Yeah, Dr. Sebastian, you got anything?
Well, so I think from a parent point of view, the things to watch out for if there has been a head injury, even if you're not aware of a head injury, if there's, if the player is complaining of headaches or dizziness, nausea, difficulty focusing, sometimes some kids refer this as to feeling like they have a foggy brain.
True.
That should be brought to our attention right away. And as Dr. Nauern was saying, I mean, our staff is very well trained. And if there's even a suspect of a concussion, we're going to see that kid very, very soon, probably the same day. Right. The other thing to pay attention to is if there's a change in school performance or even if some of the players' friends notice that something's off, just something has changed, something's just not right, that needs to be brought to our attention right away as well. We do have some concussion clinics in the area as well, neurologists and multidisciplinary groups that address concussions. And I would certainly say they know a lot more about concussions than I do.
Yeah.
And there are a lot of strict rules that need to be followed as far as concussions are concerned. If there's any question that there's a concussion, assume it's a concussion and treat it like it's a concussion.
Absolutely. No, that's
I just wanted to add to the end that, I see a lot of good things about from the team, coaching and training, that they're not pushing the kids to go, too early to back to the game. And that is the vital, again, recovery can take 2 to 4 weeks, but we evaluate if, kids is free from any symptoms 7 days, yes, he can go back. But the recovery, we do not want parents or coach or team to push them too early to, have another concussion, and that could be detrimental for their lifelong.
And either Dr. Sebastian or Dr. Naurin, where should a parent bring their child when they suspect a concussion? So meaning, if it's a weekend, should they go to the emergency department? Should they go to urgent care? Should they wait to get an appointment with their primary care? What's kind of the best strategy in terms of where to go?
So, great question. I'm glad you asked it. I think if there's a head injury, concussion, and there was loss of consciousness, you go to the emergency room. If there's loss of consciousness, or if there's an obvious sign that something neurological has changed, or they're vomiting, you go to the emergency room. If you call our office, we're going to tell you to go to the emergency room. If there's no loss of consciousness and it's the symptoms are mild headache or dizziness, I think on a weekend, we're available on Saturdays in our extended hours clinic on Amherst Street. That's perfectly appropriate to come to. Or, our urgent care in Milford is also appropriate. I don't think a concussion should wait till Monday.
Agreed.
Yeah, absolutely. Something might get evaluated right away, for sure.
Correct.
This is a kind of off the cuff question. So for me, being a football player, most of my life, there's always that difference between getting your bell rung and a true concussion. Where is it kind of based on when you see somebody during that evaluation process, you're able to kind of weed out like, hey, you took a good pop, but your baseline for everything else is fine. Is that kind of when you determine, throughout that process, if it was just like you kind of got shocked, or like, hey, there's actually something going on?
The concussion, the screening tool, it has more, physical and the psychological part. So it's a very rigorous. So based on that, yes, everything looks fine, only headache or a little bit nausea. Yes, it's a concussion, but it's not serious that I would be jumping to anything. But if in the line, even after initial evaluation, if patient, the kid come back with or call back that new symptoms, yes, we take it seriously, and then we do the follow-up.
Kendall, we don't have a diagnostic code for bell rung. It's not a diagnosis we use. Essentially, I think for a young adult or a child or an athlete, a player, young hockey player, if your bell was rung, it's a concussion, and you go and see the doctor.
I got you.
Okay.
Fair enough. Yeah.
You're right, though.
From the old school a little bit.
Yeah.
Right.
Yeah. Growing up, that's what we were told, right? I get your bell rung, get back out there, And I think, kids, they want to get back out. They want to keep playing, right?
Yeah.
So they're hesitant to even say, I have a headache, right?
I think it's clear the guidelines say for athletic trainers and coaches, if there's any trauma to the head or any suspicion, they're out of the game. That's it.
Right.
Yeah.
That's it.
They're out.
Yeah. And it's much safer to go about it that way. Like you said earlier, treat everything like a concussion. You'll be able to figure it out, once you go, through that routine. But, if you had to get taken out of game, it was for a reason.
Right.
Awesome. Let's see. Are there any regular health routines athletes should practice to best safeguard their health?
So the best way for an athlete to safeguard their health is to stay in shape, stretch before and after, and get their rest, get their nutrition. I mean, I think if you stretch, if you stay in shape, if you keep your core strong, you get your rest, you drink your fluids, and you follow a good diet, I think all of those, which are topics in and amongst themselves, I think those are the basics to staying healthy as an athlete.
Yeah,
Dr. Narayan, do you have anything to add?
No, I think, you said it right. It's, routine cardio, strength training exercises, stretching, and, as Kendall before said, ice or after the practice, take time, nutritions, and in good, health condition are the key.
Yeah, absolutely. One of the things, I actually get that question asked a lot, and what I really tell people is take everything just as serious as you take practice or you take the game. Take hydration just as serious as you take playing the game. Take rest just as serious as you take playing the game. Take stretching just as serious, because all those things together add up to you being able to play, being able to function at a high level. And it's really once you get to the point where you understand that all those are just as important. Sorry if you get to hear my kids in the background. If you understand those are all important, that's when a lot of athletes start to turn the corner. I just think about it. When I was coming up, we had those. I had those teammates that were they stuck to that routine, being consistent in that routine, and then you just notice with these guys, they were more healthy. You play in sports, you're gonna get dinged up at some point, but they tended to stay more healthy, than everyone else. They tended to recover a little bit quicker than everyone else, and it was really came down to that, exactly what you guys said. The stretching, the hydration, the nutrition, and taking the butts to bed, which is huge. So this is kind of along the same line. What are some tips for injury recovery? I think we kind of hit that. But anything else you guys think you could add? Kind of some one-offs that you think that are pretty important.
I think we already said, but if you had to see a provider or trainer or for any injury, follow their recommendation. Don't do anything reckless at that point, and do something other sports to injure your ankle if you're healing from it. So I think listening to the trainer, listening to your provider during the recovery period, and do everything that's needed so that you can get back to the game faster, right? If anything mistake happens during, okay, it's not going to hurt me, but accidentally you hurt, your recovery push back, so you go going back to sports push back too. So following all the recommendation and advice, it's important.
So men and women think very differently, and I can say when I was younger, and I wouldn't call myself an athlete, but participated in a lot of sports, the last thing I wanted to do was to miss anything. Not wanting to miss a game, not wanting to miss a practice, work through the pain. That's kind of at the same era as getting your bell rung kind of thing.
Fight through it.
So I think it's probably the hardest thing for an athlete or a young athlete or a young person to, a pill to swallow, a difficult pill to swallow, is to stop, follow the trainer or the doctor's recommendations. But it's incredibly difficult for an athlete to do that.
Yeah, absolutely. And, kind of, Dr. Narayan, as you mentioned, the chance of re-injury if you don't follow the protocol is even so much worse. It's like, being out for a week, stinks, but being out for for a month or for the rest of the season because you wanted to rush back is just, it's detrimental.
Right. And we have seen that often. So, I can tell, my son is not a amateur soccer player, and it happened. He was out for the whole season because of, rushing back to game.
Absolutely.
So
if you,
Kendall,
go ahead, Tim.
real quick, and I want to turn the tables a little bit on this conversation, and I want us to start for the last probably like 5-7 minutes here. I want to hit on some of the more mental aspects of sports, and especially youth sports, and how it's affecting our kids' mental health, and how parents can really kind of monitor that, and think about what they need to watch out for and what they can do to help their kids. And Kendall, I think you're going to have a lot of good insight here.
Yeah.
So I'm going to throw a couple questions out that I just think that we can all kind of jump in on. But certainly these days, we hear a lot about sports specialization. And it seems like there's a push at younger and younger ages to get kids, playing one sport year round, and and how that affects them both physically and mentally, and really trying to figure out when is that the right time, right? When is it the right time to say, I'm going all in on, football or basketball or hockey or whatever the case may be. So first of all, I guess my first question would be, again, for both the providers here as well as Kendall, what age do we think is kind of the right age for kids to start specializing versus when should they, kind of try a little bit of everything? Dr. Sebastian, what do you think?
God, I was hoping you would ask somebody else first. I don't think I don't think there's a specific answer to that question. I've known athletes who at a very young age, under the age of 10, just wanted to focus on swimming and, wanted to swim and become well enough and compete well enough to go into the Olympics. I think, if somebody has the talent or the ability to do that, I don't think it's unreasonable, as long as that's not coming from one of the parents or from some outside pressure. Otherwise, if you were more like myself, where I wasn't the best at anything, but I could be fairly good at a lot of things, then I think, mixing it up and playing various sports is appropriate. I think that's up to the student, the player, as long as that's not pressure from outside.
No.
I mean, I'm sure the stories still happen where, the child is living the parent's dream. That would be terrible. So I think it's very, very individual, the answer to that question. And I could be way off base there. I don't know. What do you think, Dr. Naurin?
I don't know what to say. Dr. Sebastian, we talked about it, that what is right. I think I agree with you one thing, that, if this is a child's dream or it's a parent's dream, and how much pressure, how much mental pressure. We see that a lot, It's not only a sports, we see it in, a school, in academic too, that, how, what we want from our kids, it's a little bit, failure is okay, but sometimes we are not ready to take that failure. So it's, that leads into a mental, our, others, mental disorder that we see a lot, kids are afraid to, tell that to their parents, but sometimes if you ask, this is their anxiety, this is their, depression coming from. So, I think I agree with Dr. Sebastian that it should not be a pressure, it should be the kid's choice, okay, I am ready to continue this one and this is what I want.
Absolutely. I agree with both of you guys. I mean, ultimately, we're talking about kids playing sports. I mean, kids, most likely, they play sports to have fun. A lot of kids have the dream of, being professional in whatever sport. But at that age, it's all about having fun and teaching them, some pretty awesome lessons about discipline, hard work, things of that nature. That pressure should not be coming from the parents, should not be coming from a coach. It comes from there too. Sometimes, coach will be like, hey, if you want to do this, you got to specialize in this. When they're kids, if a kid comes up to a coach and be like, hey, this is what I want to do, by all means, that coach, that parent will show them Dr. Sebastian, you got to jump around again.
Yeah.
By all means. And, as long as the kid has a love for it and is willing to do it, and that's coming from them, you know, as a parent, as a teacher, you know, let the kids follow their dream. But, you know, you shouldn't be, you know, force feeding them some story that, hey, you know, you got to do it this way, especially at that age. I mean, you know, I've seen it firsthand. I've seen guys in the NFL who didn't play football until their senior year of high school, or they played other sports. They did other things, or, you know, they played baseball. I played with so many guys who got drafted in high school and continued to play football. Not saying one way is better than the other, but I think just having the open-mindedness that one isn't better than the other, but you shouldn't force kids one way or the other either. It's ultimately their decision on, you know, if that's really what you want to do, we're going to support you. And as long as you continue to have fun, you know, that it's more so that love and support is, I think, is what's most important. And, you know, as they get older and they're like, hey, you know, there's a strong possibility I could take this further, then by all means. But when they're that young, you know, just go have fun. Have fun.
Great. Yeah. No,
Yeah.
Great lessons. So with that in mind, you know, and again, you know, back to Dr. Sebastian, Dr. Naurin, you know, we hear a lot about kids having more and more anxiety these days, you know, around sport, really around, you know, school, sports, a lot of things in general. Anxiety is certainly a hot topic. But, you know, what are some signs that parents should watch for that maybe a kid is, you know, stressed, anxious, you know, more so than what would be considered normal? And if parents feel that way, that this is their son or daughter is becoming overwhelmed by the sport they're playing, or really just by, you know, whatever's going on in their life, who should they call? You know, is that something they come to you for as their primary care provider, or is that something they go directly to a counselor for? What's kind of the best strategy there?
So definitely, you know, we as a primary care provider, we can evaluate that kid. So one thing I wanted to tell all the parents that, you know, you are the people who are around the kid all the time. You guys should pick up when your kid is showing an abnormal behavior. All of a sudden, he's not social, trying to stay more in the room, showing anxiety symptoms of going to school, before any game or before any exam. So we rely on your input, because we see them only 20 minutes. Maybe I had a physical on kid 2 weeks ago, but I did not pick on because I saw him for only 20 minutes. But, you know, he maybe did not express his anxiety, depression to me. But we need your input to see anything, anytime you see the kids is behaving all of a sudden abnormally, please bring to us. You know, you can go to a counselor, but, you know, in I can tell about New Hampshire, it's very difficult to get a counselor, when you want. So at least if we can evaluate them, you know, at least we can be watching them every so often. And definitely a therapist, school counselor, these are the places you can go as well. But I think reaching out to your pediatrician or the, a family practitioner, whoever their primary care is, come to us for with the concern, so we can, you know, not delayed, but start the process of, you know, therapy and all this and support for the kids.
That's correct. I agree. I think some of the things that parents or coaches or trainers can look for is a change in a sleep pattern. So if somebody's not sleeping the way that they used to, or not sleeping well, or looks tired and obviously not getting the rest they were before, that could be a sign that they're suffering from anxiety. Or a change in appetite. Sometimes for me, if it's stress, then I'm going to eat more, so I might gain weight. But certainly if a student or a player is not eating and looks like they're losing weight and they're not sleeping, I think those are cardinal things that we should be aware of, because those are manifestations. So those could be manifestations of anxiety. I don't think the student or the player is going to say, I'm feeling anxious or stressed. Mm-hmm. I never did. I don't think I understood any of that when I was a kid growing up, but I can certainly remember not sleeping well or a change in appetite.
Yeah, and a lot of times a coach can tell when a kid's off, and I know it does happen. So it's also out there for those coaches. When you see any of your athletes, you might be able to catch that behavior. Let the parents know, for sure. Talk to the kid. A lot of times you might get no, everything's fine. But if you kind of felt like that wasn't genuine, definitely reach out to the parents, have that open line of communication. Because a lot of times, if the anxiety is coming from sports, and this is based off of just personal experience, seeing it firsthand, a lot of times that coach can tell, you really got to be that, or the trainer as well, somebody who's there, reach out to the parents, and, let them know. Then they could monitor things at home and go through the appropriate actions after. So definitely, it takes everyone. It takes the whole group, it takes the community, it takes everyone looking out for the best interests of the athletes. And I think as long as everyone's got that, the kid's best interest in mind, that everything works out for the best.
We have to talk about it. We can't just ignore it or close our eyes or bury our head in the sand. We have to talk about it.
Mm-hmm. Absolutely.
Thank you. So hey, just to wrap this up, because I know we're at the 36-minute mark, and I promised you guys 30 minutes. So I want to get to the last few questions here. And Kendall, my first question for you is, what's the best piece of advice you have for parents and kids looking to get to that next level? So like I said, for the folks watching, Kendall here played in the NFL. Kendall went to National High School, went to college at UConn. So he's a local guy that reached the highest echelon of sports. And so what's your number one piece of advice for parents who are hoping that their kids can kind of follow that same trajectory?
For me, I feel like what I guess I understood pretty early on is I would say, any kid that plays sports wants to be a professional. That's just period. That's obvious. But I think is, setting reasonable goals. Don't think you're going to be a pro overnight or any of this other stuff, or even if that's something you have in mind. I just know based on, for me, like when I played, I just wanted to be the best at the level I was at. I wasn't concerned with what's going to happen next, because a lot of times when you're looking too far ahead, you're not focusing on what you got to do right now. And being in athletics, it's a right now type of environment. So when I was in high school, I want to be the best high school athlete I could be. Then as college came around, it's like, wow, I have an opportunity at this. Let me continue to work. Even when I was in college, I wanted to be the best version of myself. And if that ended up becoming a professional athlete, great. But really don't beat yourself up. Focus on being the best version of yourself. And with that, if you focus on that, you'll be satisfied, with the effort you put forward. You'll be satisfied resting your hat, knowing like, hey, I gave it everything I can, and this might have just not been cut out for me, but I know I maximized my potential that I had. So really, it's just kind of take a step back and just be realistic, but don't be afraid to go push yourself. But just set a goal that you can attain. Then once you get that, keep pushing that bar, and honestly, keep your head down. And you never know where you're going to end up. So just kind of be realistic, but like don't think, I had one bad game my sophomore year of high school. Now I can't go play for the Red Sox. It's like, hey, stay kind of be where you are. Focus on, your practice, focus on winning the day, focus on that. Because really being a professional in anything, becoming a doctor, becoming a lawyer, becoming whatever you want to be, it's all about you winning each of those days. Then when you stack them up, then you look at the end, you're like, yeah, oh, okay, this is where I'm at right now. Like I put that time in, and I did it the right way because I was focusing on taking each day on at a time instead of, I had a bad day, I'm not going to be pro now. Then you don't work out because you're pissed off. It's like, You're not going to win every day, but if you just keep your goal high, but your focus small, I think you're going to end up right where you need to be.
That's great advice.
Yeah,
Great.
Yeah,
Great.
big goal, small focus. All right, Kendall, I have one more question for you. It's the most important one. Did you ever sack Tom Brady? And if not, why?
If not, why? Okay. Because, have you seen this game of football? There's 5 offensive linemen that are kind of in your way. No, I did not sack Tom Brady, but I did take a shot at him, and I hit him and knocked him down to the ground. So when the Chargers played the Patriots 2014. But I'll tell you, I did sack the Manning brothers 3 times. I got Peyton twice in one game, and I got Eli, I believe, my second year. So didn't get Brady.
Almost as good.
Yeah, exactly. So I got Manning, I got the Mannings, I got Romo. I got some pretty good guys on my list that I was able to sack. So never got to sack Brady. I mean, I didn't want to hurt him. That's ultimately what it came down to. My parents would have had to move if I hurt Brady.
Yeah, you can't hurt the goat, and you're
exactly.
Yeah, so
exactly.
Well, great. Well, you know what, guys? Thank you so much for joining us tonight. Thank you for answering all these great questions. I hope it was really helpful for our audience members who are watching this live or who watch this down the road, because it is recorded and posted on both the St. Joe's Facebook page as well as the Northern Cyclones page. So again, thank you, Dr. Sebastian. Thank you, Dr. Nowrin. Thank you, Kendall Reyes. And again, thank you all. So with that, have a wonderful night.
Thank you, Tim. Thank you, Kendall.
Thanks, y'all. Good night.
Good night.